Alright. Ayan na. China-challenge talaga ako ngayong araw na to. China-challenge talaga ako ngayong araw na to. Hindi ko alam kung bakit. Alright. Okay na. Naririnig niyo ako, class? Hello? Hello? Can you guys hear me? Ooh. Can you guys hear me? Hello? Hello? I think I can hear you. Cool? You can hear me? Okay, china-challenge talaga ako ngayong araw na to, class. sabi na ano, bakit ko daw kasi kayo inaway kaninang umaga? Ayan tuloy. Ginagantihan niyo ako. Kinulam niyo ata ako eh. Kinukulam niyo ata ako, class. Alright, nasa na ba ako? Okay, kinulam ata ako ng mga students ko ngayon. Yung lecture ko, hindi maganda ang pag-uusad. Alright. So, we're here now to talk about leukemia. Where were we? Shared na? Is it shared? The window that I'm... Okay. Eto na, nag-share na. Okay na? Okay na ha? Hopefully we'll run things smoothly now. Hindi ko talaga maaabutan ng ang coagulation. Every year talaga hindi ako nakakaabot sa coagulation. Alright. So, moving back to our discussion, when you look at the patient's bone marrow for somebody who has acute leukemia, that patient has a hypercellular bone marrow, meaning there's a lot of cells in the bone marrow. Okay, hence the term hyper. And then you're going to see a patient with a lot of blasts. Specifically, 20% of blasts are present in that patient's in that patient's bone marrow sample. Now, we need to summarize the difference between AML and ALL in terms of lineage, the presence of Auer rods, and peroxidase reaction. So these are the three key factors that can differentiate AML from ALL. Okay? ALL is of myeloid linkage, hence the term acute myeloid leukemia, and ALL is of lymphoid lineage, hence the term acute lymphoid leukemia. Okay? Auer rods are present in patients who have AML, whilst Auer rods are negative or not present in patients who have ALL. Peroxidase is positive for patients who have AML, and for patients who have ALL, it's negative. Alright, so look at the key differences. Myeloid, Auer rods are positive, and peroxidase is positive. The other side, different. Lineage, lymphoid. Auer rods and peroxidase, negative. Remember last time when we talked about Auer rods in our peripheral blood smear examination lecture, you usually see it in patients with AML. Specifically, what type of AML? We have acute myeloblastic leukemia, acute myelomonocytic, and erythemic leukemia. Okay? Auer rods are present there. Peroxidase. We're going to talk about peroxidase later. Okay? This is also known as leukocyte peroxidase. Now, let's talk about the cytochemical stains that may be used in the differentiation of acute myelogenous leukemia. Okay, we can use myeloperoxidase, Sudan black B, non-specific esterase, and PAS. What does PAS stand for? You guys have studied histopathology in your last a couple of weeks ago. Dazzle me with your histopathology knowledge, Noreen. PAS. Periodic acid shift. Some of my professors would pronounce it as periodic, but the spelling is almost the same. But periodic is fine with me as long as you select the correct answers in a multiple choice question. Okay? So periodic acid shift. Alright? Now, let's talk about acute lymphoblastic leukemia. Alright? Lymphoblastic leukemia is different because we can use cytochemical stains here. Alright? But there's two types of acute there's two types of cytochemical stains that you can use for the diagnosis of acute lymphoblastic leukemia. This is PAS and TDT. Okay? PAS and TDT. And of course, the next question that you're going to expect is, what is TDT? Anybody know what's TDT? TDT is very important. It's one of the things that you need to remember when you go to the exams. So let's start first with transcription. What do you mean by TDT? Angelica Grace Vergara. All right, that's good. It was a little bit. You almost fell, but yeah, that's correct. All right. So this is your. This is what it looks like in the peripheral blood in the smear. Okay, in smear form. This is what it looks like. Now, question for people. It's not going to be asked in your board exams, but I'm just gonna ask you this question. Which one do you count? The blue one or the red one? The blue one or the brown ones? Which one? I heard a croaking sound. There was a croaking sound. What, Joanna? Confidence muna. Brown. O, di ba confident siya, parang medyo galit. Parang medyo galit kasi all caps. Ano ba naman talaga itong mga students ko ngayon? Medyo galit. All caps naman ngayon. Kasi paano ko nalamang galit? Kasi yung hehe mo, small letters, oh. Di ba? Naka-all caps ka kanin. Naka-all caps ka dun sa brown. Brown! Ganun yung magkasabi niya. Brown. Alright. Let's move on. Next question is, how does the World Health classify ALL? Ito na yung sinasabi ko sa inyo. I'm not sure if your lecturers, I don't know, when you were in third year, discussed FAB, but we're going to discuss AFB, but FAB, or the French American British classification system. But this time, I'm going to help you guys out with another one because this is a question that seems to appear in recent examinations. Okay, so the World Health Organization classifies acute lymphocytic leukemia by either be based on whether it's pre-T cell or a B cell leukemia, based on CD markers and chromosomal translocation. So when you say chromosomal translocation and CD markers, meron tayong i-memorize. Marami tayong i-memorize, class. Letters and numbers. I think you are familiar with what I'm going to say next, right? Lalabas na dyan si Philadelphia chromosome, yung mga ganon. Kala 88, Kala 50, yan na. So wag niyong kakalimutan to kasi ito na yung common trend. Okay? Please lang. Ito na yung common trend, class. Ayokong naiiwan kayo ng times kasi baka mamaya yung inaaral nyo obsolete na. Okay? So pre-ALL, pre-B ALL or pre-B cell ALL or pre-B cell acute lymphoblastic leukemia is characterized by what abnormal chromosomal abnormality pala? Trisomy 21. Oh, familiar? What's trisomy 21? Trisomy 21 is what? Alright, Down syndrome. Good. Trisomy 21. Now, what are the CD markers present in Trisomy 21. Ayan na naman, sir. Bakit ang dami? Tatlo. Tatlo ang kailangan nyo i-memorize. CD10, 19, and 20. Okay? In the exams, usually they will ask which of the following is not a marker of World Health Organization classification pre-T cell ALL, pre-B cell ALL. CD10, 19, 20, and 25. Which of the following is not? Ganun yung mga tanungan. Diba? Or, if you're going to take the ASCP or AMT, their question will be, tick the boxes of the CD markers for pre-B cell ALL. Ganyan sila magtanong. Alright? So, exam tips for you guys. Do I need to memorize? Yes, in this case, you need to memorize it. Because if you don't memorize it, most probably you would fail in answering that kind of question. So, class, lagay lang ako ng lagay. Anyway, hindi naman ako ang magme-memorize niyan. Sabi nga nung isa naming lecturer dati. Alright? Next, what is CD10 known for? This is CALA. Okay? CALA What is CALA? This is known as the common ALL antigen. Alright? CALA, common ALL antigen. Actually, when I was working there in the Philippines, CALA is just being used clinically. Before, they still don't have evidence to support the clinical importance of CALA. But now, they are using it over and over again, and you will see it also in your examinations. Okay? So, CALA stands for common ALL antigen, and this is CD10. Okay? Now, let's move on to the next one. What's the most common translocation in patients with pre-B cell ALL, and differentiate them based on prognostic outcomes? There's two types, translocations. Translocation what? Translocation 922 and translocation 1221. Sir, bakit ang daming numbers? Kailangan yung memorizein siya kasi siya na ang recent. Okay? I'm sorry, but there's no easy way out of this. Okay? And the one with the bad prognosis, meaning there is likelihood that they will not survive by the end of the year, is the one that has translocation 922. Okay? Translocation 922. One with the good prognosis is somebody who has 1221 translocation. Okay? Now, common translocations identified in B cell. Now, it's now B cell. We're talking about B cell, huh? B cell, hindi na pre-B cell. There's a lot. There's 3. Okay? So, there's 3. Translocation 814, translocation 822, translocation 28. Okay? So note, for B cell, chromosome 8 is always affected. Alright? For all B cell, for ALLs, that is a B cell, you need to remember that chromosome 8 is usually the one with the translocation. So, ang kailangan nyo na lang i-memorize, 8, 14, and 22. 2, 14, and 22. Medyo merong pattern. Pwede natin gawa ng pattern. Alright? So, you guys have to take into consideration the patterns also para mas mabilis siyang i-memorize. Okay? So, bakit siya important? Kasi this again will be asked in your board exams or in my exams. Which of the following is not a translocation or a mutation, a chromosomal mutation for patients with B-cell ALL? Mga ganon ang mga questionan. Alright? Mga ganon. Diba parang binibigyan ko na kayo ng leakage? Pero feeling ko, ika nga ni Sir Marco, hindi nila maaalala yan. Kita, ini-stress kayo ng professor nyo. Sabi niya sa akin, hindi nyo maaalala yan. Pero sinasabi ko lang, malay nyo, ulit-ulitin nyo yung pagpanood sa video or pag-click nung mga PowerPoints na sinesend ko sa inyo. It might help you out, it may not. I think some of you might say ang hard naman nito mga questions na to, but that's the reality of the profession you're coming into. Now, let's go to which chromosomal translocation is associated with Burkitt's lymphoma. It's translocation 814. Sirong hirap. May 814 nga dito eh. Okay, so you will know that it is a B-cell ALL. Alright? Burkitt's lymphoma. Or Burkitt's lymphoma. Ang arte kasi, Burkitt's lymphoma. Okay? Now, CD marker to differentiate T-cell from all other forms of leukemia identified by the World Health Organization. Okay? And there's actually one that is considered as the most important one. Mabibigla kayo sa next slide. Okay? CD markers to differentiate T-cell ALL from all other forms of acute leukemia is these 6 CD markers. 3, 4, 8, 3, 4, 5, 6, 7, 8. Medyo madali, may pattern pa rin. 3, 4, 5, 6, 7, 8. Okay, may pattern pa rin. Pero medyo dumadami na ang kailangan i-memorize, no? Medyo dumadami na, guys. Alright? Paunti na mo. Huwag kayo mag-alala, meron pa tayong FAB classification. Don't worry. Dadagdagan ko pa. Alright? Now, what CD marker? Ayan na pala yun. Now, what's the most important? CD3. Why? CD3 is a marker for the differentiation of what? CD3. What's the other name for CD3? Immunology and serology recall. CD3, guys. CD3. Naku, nakalimutan na talaga nila. CD3. Sorry, I can't hear you, Noreen. What was that? Anong panty cells? Hi! Anong kaguluhan yan? But you are kind of correct, pero yung pagkadikit, hindi maganda yung panty. Hindi siya maling... Alright, it's actually panty cell. Alright, gato, panty cell, hindi panty. Talaga nakakalurky talaga ito mga estudyante ko talaga. It's panty cell marker. It's a panty cell marker. Kaya siya, bakit siya important? Kasi dito pa lang malalaman na natin kung anong klaseng leukemia meron si pasyente. Kapag mataas ang expression ng mga cells ng CD3. Okay? So for example, they asked you a question. You are working as a research facility specializing in oncological cases. You ran a sample in the flow cytometer and the cells expressed the following. 90% of the cells are CD positive, 10% are CD8 positive. What do you think is the type of leukemia the patient, the sample has? What type of leukemia does the patient has? Mga ganun ang question. Obviously, when you see CD3, you're going to say, okay, panty cell. Ibig sabihin, hindi panty. Ibig sabihin, tawang-tawa si Joanna. Natatawa ko sa itsura ni Joanna. Para ngayon lang nakarinig ng panty. Kayo talaga. Ibig sabihin, all cell lines related to the T cell, whether it's cytotoxic, whether it's helper, whether it's suppressor, it is a marker for that particular one. Alright? That's the reason why we have what you call the panty cell, not panty. Alright? Noreen, na hindi maganda yung pagkakasabi, yung pagkakasunod-sunod. Tinan mo tuloy, naapektuhan tuloy yung listening skills ni Joanna. Okay? So, kaya siya important. Alright? Now, patients with T cells, ALL, usually have what type of unusual physical examination? They have a mass in their mediastinum. Why? Why is there a mass in their mediastinum? You're going to ask yourselves, kakaiba naman to. Bakit naman may mass sa mediastinum? Bakit ano bang meron kapag meron kang T-cell leukemia? Ano bang abnormality? Bakit sa mediastinum ang affected? O sige, Joanna. Very good. Very good. That's very good. Okay. Somebody was listening. Somebody was listening to my first lecture. Finally. Okay. Alright. I'm happy. I'm no longer getting disappointed. I love it. I love it. Okay. Now, the most what is the unfavorable prognostic marker for patients with ALL? Obviously, this is somebody who is marami. Greater than 60 years old, patient with greater than 100,000 WBCs, mature B cell type and early T cell type are present, and the Philadelphia chromosome is present. Okay? For translocation 411 is also present. Okay? Hindi maganda ang outcome usually niyan. So, poor prognostic or unfavorable prognostic markers. So, these are the things that you need to take into consideration. Bakit ganon? May Philadelphia chromosome dito sa ALL. Well, you're going to see it as well in AML. We're going to be specific later on. Okay? But, there's a true or false question here. The Philadelphia chromosome is also found in other forms of leukemia. Yes, it is found also in patients who have CML, chronic myelogenous leukemia. Okay? But, if it's found in patients with ALL, it means that why? It means what? It means that the patient's leukemia is Oo, pero bakit? Bakit nga bumaba ang chance niya? Kasi nagta-transition na siya to CML. Alright? So tama, Joanna. This time, from ALL, rinig ko nga yung boses mo eh. Pinagtatawanan ninyo ang connection ko dahil nandito na ako sa Philippines, ha. Huwag kayo. Grabe ka talaga. Grabe talaga tong ano nyo. Pati ako, hindi ako nakaligtas sa pambubuli. Alright. Now, we have a nice to know question here. Alright, so we have one nice to know question here. Another name for translocation 411, which is used as a prognostic marker for ALL. Okay? Google na kung gusto. There's no problem with me. As long as you're interacting and as long as you're moving your hands to look for the answer, that's fine with me. Another name for translocation 411. Sino yun? Hindi ko nakita. Mabilis mag-Google. Grabe, ang bilis mag-type. Sino makakasagot? Another name for translocation 411. It's what? Parang feeling ko mahirapan kayong hanapin ang other name niya. Because it's what? It's MLL AF4 fusion gene. Diba ang haba ng other name niya? Grabe naman. Yan na lang ang tawag sa kanya. Translocation Translocation 411 na lang, no? Kasi yan yung complete they call this cytogenetic name. Okay? So MLL AF4 fusion gene. Okay? So that's the full name, or at the very extent that's the most most amount of detail I will leave for you guys. All right, now patients with poor prognosis should opt for what form of treatment? Bone marrow transplant. Why? Why do we need bone marrow transplant? Because the cells have already been abnormal. Okay, the cells have been abnormal for quite some time now, and they might what? What's one of the things that we need to avoid? What's one of the things that differentiate neoplastic cells? They replace normal cells, right? And they invade normal tissue. So, in order for a patient to have a good outcome, they need to have bone marrow transplantation. So how does bone marrow transplantation happen? You need to find, of course, a patient who is what? You need to have a donor first. You have to have a donor first. A match donor. Kayo talaga nakikita ko yung mga mukha ninyo. Ang saya-saya talaga magtanong, Sir Marco. Kasi parang ang layo ng mga iniisip nila. Anong unang-una mong gagawin kapag magkakaroon ng transplant? Of course, kahit sa donation, di ba? Kahit sa blood transfusion, di ba? Sir Marco, hanap ka muna ng donor na kamatch mo. Nakikita ko yung mga itsura nila. Natatawa ako sa mga itsura nila. Kasi parang ang layo nung iniisip. Oo, ang saya pala, no? I hope this becomes a trend. Kasi parang masayan makita yung mga itsura, lalo si Charizo, lumalaki yung mata kapag alam niyang may break. Alam ko si Charis lang yung natuwa na nagkaroon ng brownout sa amin.
Sir, brownout din po dito, sir.
Woo! Alright, di ba? Classmate! Classmate sa brownout. Kabwisit. Ang init dito. Gusto ko nang bumalik. Alright. Now, we're going to go back to the basics, of course. FAB classification, the easiest one that you will encounter. It's still asked in the board exams, and we're still going to include it in this discussion as well of ALL, all right? Acute lymphoblastic leukemias. All right? So, FAB classification has 3, L1, L2, L3, or Burkitt type or Burkitt cell type. All right? How do we differentiate it? Based on the size of the blasts. The smaller the blast, the smallest blast is the one in L1. Large ones are seen in L2 and L3. Medyo parehas pa rin, sir. Homogeneous. Morphological diversity of the blasts, they are homogeneous, meaning hindi pare-parehas. Okay? They look the same, morphologically similar. But for L2 and L3, these are commonly heterogeneous. Okay? Another notable feature, children are commonly affected. Okay? Children are commonly affected. And for L2, adults are commonly affected. Okay? So you might see a case presentation. Patient is a known case of is a case of ano ba magandang question, parang ano sa kanya, example. Yeah. A 5-year-old patient with small blast cells of lymphoid origin have been seen in a patient's cell in a patient's peripheral blood smear. The cells appear to have the blast cells appear to have the same appearance, with a few cells varying from the rest. Describe the FAB classification. Given the following description, what is the FAB classification of the patient? Something like that. Alright? Now, morphological features. We're going to look at the morphological features of a Burkitt cell. If your patient has Burkitt or L3 lymphoma or leukemia, L3 FAB ALL, that patient is going to have lymphoblasts with noticeable vacuolation. All right? This is what you call vacuolated blasts. Look at the cells carefully. Okay? How do I know it's a blast? Look at the cytoplasm. Look at the size. All right? Diyan na naman tayo. Yan ang sinasabi ko sa inyo kung yung basics last time hindi nyo ma-appreciate, paano pa si advanced, 'di ba? Kaya talaga nanggigigil ako kanina kasi nung nakita ko may sumagot na mali ang cells na pinipili. Paano pa ito, 'di ba? Paano pa kung ito ang ipinresent sa inyo, di ba? Ako to, ay, hala, monocyte yan na may kinain na bakterya. Di ba? Gaganon. So, kaya, toxic vacuolation yan. Naku, patay tayo dyan. Alright? So, how would you know? How would you know if it's a lymphoblast? Look at the cells first. Look closely at the cells. Okay? Now, when you look at the cell, look at the cytoplasm. Look at the color of the cytoplasm. Is it blue? Is it pink? Remember, from our previous lectures, what? The younger the cell, the more blue the cytoplasm is, right? And look at the size. Look at the size of the cell. Compare it with the lymphocyte at the side. Right? It's smaller. The one on the side is smaller, meaning it's what? Is it a younger cell or a mature cell? Ala, very good. Diba? So, see? Now, if you want more details, look at the nucleus. What's the appearance of the nucleus? Is it dense? Is it homogeneous? Is it what? Is it what? Is it coarse? Oh, patay tayo, hindi nila alam kung anong ibig sabihin. Nakikita ko si Joanna gumagano, no? Sinisipat talaga niya eh. This is from a person who has worked in the laboratory for a couple of years now. Pag parang felt paper yung texture, yung parang pag kinamot mo, parang pag ginanon mo siya, parang felt paper siya. I will attest to that it is a young cell. Okay? Now, how do I know if it's younger than what I expect? Look at the nucleoli. Nakikita nyo yung nucleoli? Yung parang mga maliliit na shadings sa loob. Nakikita nyo ba? Clear ba dyan, Sir Marco? Ma-appreciate mo ba yung nucleoli, Sir Marco, dyan?
Medyo hindi.
Hi!
Kita.
Kita?
Ako dahil alam ko hinahanap.
Oo. Kaya natatakot ako sa kanila kasi baka mamaya hindi nila nakikita yung tinuturo ko. Nag-aalala talaga ako. Makita niyo yung mga green. Ay, yung mga green, yung mga bilog green tuloy. Lalo ko kayong nililito tuloy. May mga maliliit na bilog sa loob na parang shading. Nakita niyo siya? Tingnan niyo yung nucleus. Hindi yung form. Huwag yung vacuoles ang tingnan niyo. Parang may shading siya na maliliit na bilog. Nucleoli ang tawag doon. Parang gumamit ako ng purple, tas gumamit ako ng mauve na purple. Or diniinan ko yung pag-shade ko.
Ano ba yung mauve na yun?
Mas madilim na violet. Ano ba? Mauve. 'Di ba ang arte? Violet na nga siya, 'di ba? Tapos pina-violet ko pa lalo. So,
It's same shade ng purple. It's a smaller circle inside the nucleus.
yeah. So, nakita nyo? Nakita nyo yung yellow? Christine, nakikita mo ba parang she is not having it? I don't see it. I don't believe you, sir. Ganon na ganon yung itsura ni Christine Murillo, eh. I don't believe it. Bigla nag-off ng camera. Bigla nag-off ng camera. Pero, sir, I don't believe it. I don't see it. I don't know what you're seeing. Ganon. Pero, hindi kasi wala akong laser pointer. Nakikita nyo ba yung laser pointer ko? Hindi kasi yata lumalabas dyan yung laser pointer eh. Nakita nyo yung mouse cursor ko? Class? Kita nyo yung mouse cursor? Hindi siya nakikita eh. Sorry. Limited ang natin, ang resources. But, look at it carefully. It's the same shade, sabi nga ni Sir Marco, it's the same shade of violet, but it's darker. You can see it. Okay? But enough about that. Let's talk about acute myelogenous leukemia. So baka mamaya makita kayong cell na ganito. Don't confuse it with toxic vacuolation. Okay, Adrian? Alright. So don't confuse it for toxic vacuolation. Alright. Now, let's talk about acute myelogenous leukemia. I have a true or false question. Other forms of leukemia can lead to AML. True or false? True. Okay, paano pag tinanong kita ng why?
Yung AML ko, pwede pong sa secondary.
Condition. Alright. Okay, girl. I like that answer. Alright. It can arise from CML, okay, as a secondary condition. That is correct. Now, secondary AML can arise from what other hematologic disorder. So for example, you don't have AML, but this time it can become AML from what other types of hematologic disorders? Well, we have aplastic anemia, MDS, hindi siya Miriam Defensor Santiago, mamaya na yan, and myeloproliferative disorders, such as those of CML. So, pwede siya maging CML, pwede din siya manggaling from CML. Nagets nyo? So, my first question, AML can arise from CML as a secondary condition, yes. This time, it can also be from secondary AML from CML. Okay? So now, what is MDS? Hindi Miriam Defensor Santiago yan, ha? Medyo matagal na siyang wala. Wag ganon. What's MDS? MDS. Diandra. Very good. Very good, very good. May follow-up question ako sa inyo, class. Lalagay ko dito, ha. Kasi mauubusan tayo ng time pag inisa-isa ko kayo lahat tapos hindi makaano. Give me an example. Give me an example of MDS. Okay? Marami siya. So, just pick one. Okay? And we're going to move on. And I want to see your answers as we're discussing. Okay? Now, let's talk about the genetic abnormalities in patients that can lead to AML. Down syndrome is one, Turner syndrome is one, and of course, Klinefelter syndrome is one. What's Down syndrome? What translocation is Down syndrome? Patay. Okay, very good. Alright, very good, very good. Trisomy 21. Now, let's summarize all the AFB classifications in one slide. Para mabilis nating maalala, guys, lahat. Okay? So we start first with M0 to M7. So we actually have 8 types of AMLs. AMLs. We have several according to FAB classification. Okay? Now, sir, bakit FAB ka kaagad? Bakit hindi ka nag-discuss ng World Health? Kasi baka sumabog yung ulo ninyo lahat. Okay? Kasi dun sa World Health pa nga lang sa World Health pa lang ng ALL, medyo masakit na sa ulo, 'di ba? And nag-start na sila magtanong noon. So maybe next year pag nagkaroon tayo ng mga when we get an idea of what they're going to ask. But as of the moment, according to some of my previous students as well as my classmates who took the exams in different places around the world, they still haven't been asking questions about AML and about AML's World Health classifications. But there is also one. But a lot of hospitals still rely on FAB classifications. So this is the one that we're going to discuss. Okay? Now, M0 is myeloblastic leukemia with minimal differentiation or minimally differentiated. Okay? M1 is myeloblastic leukemia without maturation. Okay? M2 is myeloblastic leukemia with maturation. Okay? M3 is pro-myelocytic leukemia. M4, myelomonocytic leukemia. M5, monocytic leukemia. M6, erythroleukemia. And M7 is megakaryocytic leukemia. Look carefully at everything. Okay? Look careful at everything. From M0 to M4, everything is associated with granulocytic precursors. Then, suddenly, with M5, we move to a monocytic precursor, an RBC precursor and a platelet precursor, right? So, medyo mapapadali yung pagme-memorize ninyo. And I know it's a lot of memory work. Unfortunately, that's the what do you call this? That's the reality of our profession. You need to understand these types of concepts first before you need to memorize these types of concepts first and then understand what's going on in them. What do I mean by minimally differentiated? What's the difference between proliferation, and differentiation? Sige nga. Proliferation. What's the difference between proliferation and differentiation? Nakikita ko si Ana Jamema nagta-type. I have a feeling she's typing it on Google, but that's fine, girl. I'm not gonna judge you. At least you're using your internet to search for some useful information, and you're not just relying on TikTok. Okay? All right. So, what's the difference between differentiation and proliferation? Bakit hindi nagsasalita, Charis? Charis, bakit hindi nagsasalita?
Sir, pag proliferation po yung magpumpa.
Okay.
Pag multiply po ng 7.
O, ano si differentiation?
Differentiation po. Yun po yung pag mature na po. Ito different type na po ng cell.
Wow, very good. At least somebody understood. Oh my gosh. You make me so proud, girl. And it all came from Google or just from you?
Sir, yun po. Nagpapin ko lang sila ng
Oh my God, somebody remembered my... Oh my God, at least somebody remembered. Very good, very good, very good. Okay, so all you need to do is translate that to English and then paraphrase that into several things, and you can understand the difference now in if it's asked in your exams. Okay, so most of the time they would ask you that question. All right. So thank you so much, Charisse, for that answer. So myeloblastic leukemia with minimal differentiation. Basically, these are abnormal proliferation of mildly differentiated cells. Okay? So hindi pa nila alam kung hindi pa nila alam kung anong klaseng cell type sila. But we know that they are myeloblastic in nature. Okay? Now, myeloblastic leukemia without maturation, all right? Majority of the cells are blasts. Okay? We will talk about that one later. Now, M2, myeloblastic leukemia with maturation, and majority of the cells are above the myeloblastic stage. Okay? Now, acute promyelocytic leukemia, the predominant cell is promyelocytes. Okay? Lastly is M4. Myelomonocytic leukemia is what? The last stage. Why is it the last stage? Because after the myelocytic stage, they differentiate into what? The granulocytes, eosinophils. What else? Eosinophils. And speak specifically of the other cell types. Now, when we move on to M5, 6, and 7, just remember it's monocytic or monoblastic in nature, erythroleukemia, and megakaryocytic. You'll be able to understand it easily. Now, let's summarize the cytochemical differentiation of all AML, with the inclusion of ALL, of course. Okay? So, FAB classification, all you need to remember, everything tests positive for myeloperoxidase except for M6 and M7. Bakit? Ano ba si M6 and M7? Ano sila? Hindi sila myeloid lineage. Kaya wala silang myeloperoxidase. Kasi nga, yung pangalan ng stain is, o yung cytochemical stain is myeloperoxidase. Myeloid precursor ba yung Myeloid precursor ba si erythroid precursor? No. Myeloid precursor ba ang megakaryocytes? No. Therefore, they will test negative. Sudan Black B is also going to mirror the same results. Okay? It's going to mirror the same results. It's going to have M6 and M7 as negatives. Okay? For periodic acid shift, there's only one of them that will test positive, and that is M6. Okay? It is diagnostic or diagnose it if more than 50% are precursor cells. Okay? Now, let's go one by one. Now, if all three, if both of them test positive for this one, the diagnosis is reached as M0 if less than 3% test positive. Okay? If more than 3% is positive, diagnose it as M1. Okay? For M2, there's what you call a Pelger-Hewitt anomaly. Ano nga yung Pelger-Hewitt anomaly? Ano yung Pelger-Hewitt anomaly?
Yung may business.
Very good. And what does it indicate? Tingnan natin kung talagang nanood kayo ng lecture tsaka ginawa yung activity. Pelger-Hewitt anomaly. My previous professor said it was Pelger-Hewitt anomaly. Or Pelger-Hewitt anomaly. I don't know what's the correct pronunciation, but as long as you select the correct one in the exams, that's fine with me. So, what is the problem with patients who have Pelger-Hewitt anomaly? Deandra pala. Sorry, Daniel tuloy. Deandra.
People not segment you.
Very good. Alright, wonderful. Failure for the cells to segment. Alright, now, for M3, a diagnosis is reached if there is clotting disorder. Alright? Test positive for myeloperoxidase, Sudan Black B, and then there is a clotting disorder. Okay? Now, M4 is reached if it's positive for MPO, SBB, and it's positive for both non-specific esterase and specific esterase. Okay? Myelomonocytic is positive if there is a predominant presence of monocytic precursor cells. All right, in the peripheral blood. How do I know if it's a monocytic precursor? It will look like a monocyte, but there is what? Cool? So understood? Medyo mabilis ang pacing. Just rewatch the video if you're not comfortable in answering these questions in the exam. Okay? If you still feel like you're not yet ready to answer. All right? Now, what I need you to remember is this one first. Everything else will follow if you put in the effort to memorize this one. Everything else will follow if you put a lot of effort memorizing this. I assure you, when you memorize it and you know it and when you know it at the back as if it was the back of your hand, you're going to do well in terms of leukemia. Okay? Why? Bakit, sir? Kasi a lot of questions are taken by the board examiners here. Alright? And maybe me, I don't know. Alam niyo naman ako, hindi simple ang mga tanungan ko, di ba? Makita niyo naman ako, kino-contest niyo pa nga eh. Di ba, Sir Marco? Kino-contest pa nga nila eh. Kasi ang hirap na ng mga tanong ko. Okay? Adrian?
Nakatausap na naman ako sa kanila next week.
Oo. Nako. Kalahati ng Hematology 2 is more on case presentations as well as analysis. So you need to have a detective's mind in your when you're answering the questions. Okay, look at everything. Wag nagmamadali, guys, ha. Ilang oras ba sila mag-exam, Sir Marco?
2 hours.
2 hours naman pala eh. Bakit nagmamadali kasi yung iba? Yun yung problema natin dyan. Ang mga bata talaga ngayon mapupusok.
Nagugutom agad. Ganun.
Hindi ba sila pwedeng magdala ng food? Di ba pwede naman sa exam room ba sa ano? Pwede kaya ta magdala ng food sa exam, sa board exam.
Sir.
Oh.
2 hours lang naman sila in a day. 9 o'clock pa yung start. So,
Ay, grabe talaga tong mga bata ngayon, ha? Pwede naman kayo, pwede ba sila, hindi sila pwedeng kumain? Ay, oo, kasi we're assuming that everybody is cheating, right?
yes.
Yeah. So they might put it on the biscuit wrappers, the answers to. Baka mamaya niyan may nakalagay na binigyan ko ng cheats, no? Cheats ahoy! Nakasulat doon sa wrapper ng Vita. Nakalagay doon yung M1, M0 to M7. Kasi alam ko may mga malulupit na ganun, may mga ninja na ganun eh. Tama, bawal silang pakainin. Pahirapan mo yung mga yan. Sige, bawal kumain kapag hindi natapos yung exam. Tama, sige. Kasi may mga ninja na ganyan eh. Alright. Now, what's the most common type of AML? Based on epidemiologic markers, the most common type of AML is M2. Now, without looking at the slide, what is M2? The previous slide, what's M2? Oh. M2. M0, myeloblastic leukemia with minimal maturation. M0 is, M1 is what? M1 is acute myelogenous leukemia with or without maturation. Without maturation. M2 is with maturation. Kayo talaga, nakalimutan nyo na. A couple of seconds lang. Okay? With maturation. O, diba? Now, World Health na tayo. What's the translocation? 821. Okay? There's a translocation, chromosomal abnormality. If we're talking about chromosomal abnormality, we are talking about whether it's a translocation or a deletion or substitution. Okay? Now, genetic abnormality present in patients with M3 is this one. World Health ulit. You need to memorize 1517. Okay? Translocation 1517. Okay. Coagulation disorder that is associated with AML. Nako, aabot ba tayo ng coagulation? Feeling ko hindi na tayo aabot ng coagulation. So, hindi ako magtatanong ng coagulation. Parang yung brief, not PowerPoint presentation, but a word na lang. I-print out ko na lang sa para i-print out na lang nila. It's a word form of a lecture. It's not like this. Basically, it indicates what type of tests are given. Okay? What type of tests. I will take out some of the questions there. But don't worry, walang case presentation with that one. Okay? So, swerte kayo sa akin sa coagulation. Actually, mas maganda ang coagulation. Mas madami ako maiisip na case presentation. So, swerte kayo. Okay? Now, coagulation disorder associated with AML is what? DIC. What's DIC? What does DIC mean? Let's try somebody from Angelica. What does DIC mean? Tinype pa niya muna. Tiningnan lang muna niya. Type nyo na sa Google. Kayo talaga, nahiya pa kayo sa akin. Hindi ko naman kayo ginajudge. Kayo talaga. Angelica naman, nahiya ka sa akin. Okay lang yan. Oh, ayan na. Sige, while she's looking, is anybody here willing to help her? Oh, sige, Joanna. Kailangan talaga ni Sir Marco, kailangan talaga niya ng training for for self-confidence while answering the questions. She's stuttering, she's stuttering and she has a lot of hesitations when she's answering. Okay? So we need to help you out. Sino nga yung kapartner mo kanina na i-match natin sa iyo? Si Angelica din ba 'yon? Parang si Angelica din ata. Ha? Si Adrian, hindi si Adrian. Si Adrian kahit mali, confident ang sagot niyan eh. Si Adrian. Sino kayo ka-partner niya kanina? May ka-partner siya kanina eh. Kailangan they need to work out their... Sino?
Si Noreen.
Yeah. Kailangan niyo mag-partner ni Noreen ha. May bala ka ba magtrabaho abroad?
Yes.
Okay, one of the exams that you're going to pass by is IELTS. You're going to have a difficult time if you answer with a lot of hesitations, okay? So, right now, ngayon pa lang binibuild up ko na confidence mo. I want you to answer confidently, ha? Diba? You're going to have a big problem with speaking if you keep on answering with a lot of hesitations and pauses. Okay? Alright? Okay. So, right now, we need to practice. Okay? Now, disseminated intravascular coagulation is something that you need to remember for M3. Okay? So, what does M3 stand for? Promyelocytic leukemia. Okay? Now, meron na naman tayong isinama na out of the box. Gingival hyperplasia. Diba? Lumalaki yung gums. Gingival hyperplasia. So, wag kayong masyadong masama sa mga classmates natin na malalaki yung mga mga gingival cavity, yung mga gingival nila, area nila sa yung mouth nila, ha? Hindi vaginal, wag kayong tawa. Adrian, wag kang tawa ng tawa, hindi vaginal. Gingival. Pag sinabing gingival, yung gums, okay? So, wag nating nilalait yung mga kaklase natin. Baka mamaya may pinagdadaanan pala sila. Okay? So,
Kalahati ng smile nila pogi lagi.
oo, ganon. Alright? So, 90% of the smile is gums. So, wag nating nilalait. Baka mamaya may pinagdadaanan pala. M, ano yung pinagdadaanan nila? M what? M5. Okay? Bakit? Paano ko maaalala, sir? The word mouth has 5 letters. Okay? So, yan na yung mnemonics ninyo. Okay? So, baka mamaya ang dami kong binigay sa case presentation. Tapos makikita mo lang, the gingival cavity is somewhat hyperplaced. Or has hyperplasia. Diba? Dali, nasagot nyo na. Which of the following disorders would most likely be the case? Diba? Mga ganun. Mamaya ang dami kong nilagay-lagay doon ng mga keme-keme. Pinaglalagay ko yung buong buhay ng pasyente. For example, yung katulad ng ginawa ko, the Baltar, ano ba yan? The Gagaso Clinic, yung ganun kahahaba ng mga ng mga questions. Tapos nandun lang pala sa baba yung keyword, gingival hyperplasia. Tapos nakalimutan nyo pa siya. May 1 point na sana kayo. Alright? So baka mamaya ibigay kong, malay nyo, tamaan ako ng kulog. Bigay ko as ganon. Now, let's talk about the variants of M5. We have what you call diguglemus M5A. Sorry, mamaya pa pala yung diguglemus na yan. M5A and M5B. Okay? Now, M5A is differentiated from M5B by the number of granulocyte or the percentage of granulocyte. Okay? So, granulocytes are less than 20 as opposed to M5B, which is greater than 20. And the opposite mirror. Results will be expected from both the monocytic precursors. Okay? So look at the differences. Let it melt in your brains and marinate in your brains. Okay? Because we're going to move on with the next one. Another name for M5 is Schilling's leukemia. Okay? Why did I add it here? Maybe in your exams, they say that the patient is a known case of Schilling's leukemia. Mga ganon. Bigla kayong binanatan ng mga ganong kemerut na bigla kayong binanatan ng mga kemerut na mga ganon. Tapos sabi ko, ano yung Schilling's leukemia, sir? 'Di ba? Bigla kayo na nagulantang na ganon. O kaya mamaya bigla kayong tinanong Burkitt's lymphoma. Pinaltan lang Burkitt's leukemia. Nalito kayo. Pwedeng mangyari 'yon. Ini-etchos kayo, 'di ba, ng examiner. Same like yung ginagawa namin ni Sir Marco sa inyo. Ini-etchos namin kayo kapag nag-e-exam. Kasi Sir Marco, ano yung ginagawa natin pagka nakikita natin sila nag-e-exam? We are doing an evil laugh. yung tawa na nakakaloko. Alright? So, kailangan tandaan niyo yung mga other names din, ha? Other names, okay? Please don't forget them. They're as equally important as everything else. Now, if you're going to look at M5 in an immunologic standpoint, you're going to study it using CD markers. Okay? Now, for CD markers, what we're looking for is CD11 and CD16. Okay? CD11 and CD16. Now, another name for M6 is Diguglemus syndrome. Okay? Diguglemus syndrome. Another name for that one. So again, it might be asked in the exam. Patient is a known case of Diguglemus syndrome. What do you think is the most important? What do you think is the most predominant? Or what is the neoplastic cell that is predominant in this patient's bone marrow, or that is present in the patient's peripheral blood smear? Mga ganong kemerut, di ba? Bakit? Ano ba si M6? What's the name of M6? What is the name of M6? Ano ba siya?
Acute erythroleukemia.
Alright, very good. Oh, girl, I'm so happy kahit brown out sa inyo, you're still looking at the bright side and still studying for your future. I love it, girl. According to Adrian's accent. Diba? Adrian, ganun yung accent mo, no? Girl, I like that answer. Mga ganon. Alright, now, Diguglemus syndrome. Now, which type of leukemia can be treated with vitamin A? Very random. This is, I was supposed to say here, nice to know. Which form of leukemia is treated with vitamin A? M3. Okay? M3. No further discussions because that is actually going to be a question if you took medicine. Okay, there's a very long biochemical pathway that you have to study. Why vitamin A is the preferred treatment for M3, and that's the extent of my explanation for this particular topic. Now let's move on to prognostic markers or poor prognostic markers. So for poor prognostic markers, you need to look at the age of the patient as well. If the patient is greater than 60 years old, then that means he might not live long enough for to survive this disease. Also, if you look at the WBC count, if it's greater than 100%, there's something wrong with the patient. Okay? Now, AML can be secondary to other bone marrow disorders like MDS and CML. Okay? Now, babalikan natin si MDS. Ano yung mga pinagsasabi kanina ni Charis? Refractory anemia. Okay, hindi mo na kailangan sa akin isa-isahin sana yung refractory anemia. Pero okay, sure, I appreciated it. Okay? Another form of MDS is MMM. Myelofibrosis with myeloid metaplasia. Okay? So, nagiging fibroid tissue yung mga myeloid precursors and nagpo-form siya ng tough tissue. So, ano nangyayari? Relate natin dun sa RBC anomalies. If the patient has a lot of fibrous tissue, when during the process of extrusion or bone marrow extrusion, what would happen to the RBCs? Anong RBC anomaly ang may expect natin kapag may fibroid tissue na nakabara? So imaginein mo si Adrian, ganyan siya kalaki. Lahat kayo nakabara kayo sa kanya. Tapos parang made of gummy worm siya. Yung same material with gummy worms. Sa tingin nyo, pag lahat kayo nakaharang tapos lumakad si Adrian sa pintuan na napakaliit, imagine yourselves as fibroid tissue. Okay? Tapos dumaan si Adrian, ganyan siya kalaki, made of gummy worm materials or gummy bear materials. Buo-buo pa ba lalabas si Adrian? Hindi na, 'di ba? So, ano ang mga RBC anomalies na expect natin? Hala, nakalimutan na nila, hindi yata talaga sila nanood. Anong lalabas? Magiging dacryocyte or schistocytes, 'di ba? Mahihiwa-hiwa yung mga cells or mahahatak ng fibroid tissue. Okay? So that's what you call cellular trauma. Okay? So, using Adrian as my analogy, Adrian the gummy worm as my gummy bear analogy. Lahat kayo nakabara and you guys are fibroid tissue, tas lalabas siya sa may auditorium ng CMMC, hindi siya magkasya kasi nakabara kayo lahat doon. Sabihin niya, hinahanap ako ni Sir Marco. Pagka gano'n, naiwan yung kamay ni Adrian, na-stretched out yung kamay ni Adrian. Kasi he's made out of gummy worms, right? Or gummy bear material. So that's my analogy. That's what happens to you guys when you have myelofibrosis with myeloid metaplasia. Okay? Alright? So understood? Okay, hopefully may naintindihan dun sa may sa sinabi kong analogy na yon. Alright? What else? CMML is also another example of myelodysplasic syndrome, CML, sorry. And of course, we have an FL3 mutation. What's an FL3 mutation? It's again the same transmutation, the same translocation that we talked about earlier. Okay? Now, let's go on with chronic leukemias. There's two types of chronic leukemias. But before we continue, I'm going to ask you a question from the previous examination. If you see basket cells, what is the chronic leukemia that we expect? If you see basket cells, what is the chronic leukemia that I'm talking about or that you're going to expect in the exams? Basket cells. Patay tayo talaga dyan. Hindi talaga sila nanood. Hindi talaga sila nanood. Yan yung mga common questions, class, ha? Basket cells. Before we continue with chronic leukemia, because we're relating it to our peripheral blood smear analysis. If you see basket cells, you're going to assume what disorder is present in the patient's is what disorder is in this case. Basket cells. Ano bang other name ng basket cells? Smudge cells. Diba? Kayo talaga nakalimutan yun na. Video number 2 yun, guys. Puyat pa ako noon. I'm about to go to my flight pero I recorded it for you guys. Kayo talaga. Nasasad talaga ako. Nasasad talaga ako para sa inyo. Alam nyo ba, puyat ako noon, pero sabi ko, sige, bibigay ko sa kanila kasi hindi ko sila makikita for Friday's lecture. Sige, ilagay natin yung basket cells. Nako. Walang makakasagot. Ibibigay ko yung chocolate na ibibigay ko dapat kay Adrian. Ipapasalubong ko kay Adrian. May kapalit na, no?
Ang baba nilang energy nila. Pagod na.
Oo, pagod na. Joanna said CLL. Ibibigay ko talaga kay Joanna yung ibibigay ko Joanna yung mo. Hindi, joke lang. Char lang, meron ka pa rin. Ano ka ba? Alright, so si Joanna yung unang nakasagot and Joanna yung i-accept ko. Kasi Angelica, bakit? If you've been listening to me, I don't like uncertainty. And adding PO and a question mark on your answer is a message to me that you know that you are uncertain with your answer. Alright? So, pinitraining ko na kayo with your confidence level. Gayahin nyo si Adrian, di ba? Kahit mali yung sagot, sasagot yan. with confidence. Alright? Now, let's move on to chronic leukemias. Pinapatawa ko kayo kasi I can see your faces, inaantok na. Tino, si Angel, sumasara-sara na yung mata. nag-close ng camera. Si Angel, sumasara-sara na yung mata. Tapos si Charis, lumalaki yung mata lalo. Alright, now, let's talk about them in general terms. How many blasts or the percentage of blasts is present in cases of chronic leukemia? Well, there is 10%, less than 10%. You would notice that, sir, bakit parang akala ko ba pag leukemia, madami ang WBC precursors? when you're talking about chronic leukemia, it's quite the opposite. You're seeing a lot of mature cells. Okay? You're seeing a lot of mature cells, but not a lot of blast cells. So less than 10%. So for example, a patient came into the laboratory and you ran the sample. Sorry. You ran the sample and the WBC count is around 55,000 or 65,000. You look at the smear. Oh gosh, there's a lot of lymphocytes. But they're mature. All right? So, what's the problem with the patient? You can postulate or make an educated guess that the patient has a form of leukemia, but whether acute or not, you can tell also. All right? Ano ako? Nasa mid ako. Sorry. Now, let's talk about chronic leukemia. Walang. Tubig break. Consumable yan. Sino ba yan? Okay, sorry. Sorry, class. Medyo nasa mid. I don't know. Alright, now. Let's talk about the age group. Okay? What age do most chronic leukemias present the onset of their signs and symptoms? Can you guys guess?
50 to 60 po.
Alright, very good. Or greater than 60. Alright, so 50 to 60 is fine. Okay, we can say greater than 60. Okay, maybe she's reading a different book, because if you're using RODAC, you're going to see 60%. 60 years old and above. But if you're using a different book, you would see 50 to 60. But again, that is acceptable for me. Okay? Now, let's talk about chronic myelogenous leukemia next. Okay? Now, chronic myelogenous leukemia belongs to a group of disorders known as myeloproliferative disorders. What diseases are included in this group? O, diba? Yan na. Ayan na yung mga tinatanong ko. Madami siya actually, pero sinabi na ni Charis yung isa kanina, refractory anemia. So, let's add polycythemia vera, okay? Essential thrombocytosis, and myelofibrosis with myeloid metaplasia. Okay? So, you might encounter a question like, which of the following is a myelodysplasic syndrome, or an MDS? All right, or myeloproliferative disorder. Okay? So you need to remember these three, as well as refractory anemia. Actually, if you study deeper into hematology, you will encounter everything that Charis said earlier. How to differentiate it, pero in this exam, I think in the exams they rarely ask about refractory anemia. So just for your information, refractory anemia is anemia that is not usually corrected with transfusion. So basically, these patients will present themselves as anemic, somewhere around 7 or 6 grams per deciliter of hemoglobin. And then with transfusion, supposedly, these types of patients will have an increase in their hemoglobin levels. But because of the term refractory, they don't get anything out of it. Even though they were managed, even though there's something that's being done, there's something being done into their body to manage the disease, it still doesn't correct the problem. So that's the general reason why it was called refractory anemia. Okay, so let's continue on. All right. Chromosomal abnormality present in patients with CML. O yan na, madali na to kasi kanina sinabi ko na to eh. What's the chromosomal abnormality here? Translocation what? 922. What's the other name for translocation 922? Alright, the Philadelphia chromosome. I love it. You're answering much more confidently now. I love it. Okay? So, I want you to channel Adrian's energy when he's answering the questions, even though he's risking making a fool of himself by answering with the wrong question. He is still delivering it with a certain level of panache and confidence. And that's the thing that you need to channel, Joanna, okay? All right? I think friends naman kayo ni Adrian, so I think you would do well under his confidence tutelage, right? Turuan mo maging confident, okay? Now, what is a proto-oncogene? Proto-oncogene is something that you talk about when before something becomes an oncogene, all right? So oncogene that is associated, or the oncogene is translocated in cases of CML, is what you call the ABL gene. Alright, so the ABL gene present in chromosome 9. Okay? BCR gene is also another one, which is chromosome 28. Now what happens in CML is that there's going to be a fusion of the two genes as meiosis happens. Okay? As the cells divide, the abnormality or the mutation here is when there is a fusion of the gene. And that's what you call Philadelphia chromosome. So basically, I'm just discussing to you what is this. Why this becomes like this. Okay? So BCR and ABL are portions of chromosome 9 and chromosome 22 that fuse together and form an oncogene known as the Philadelphia chromosome. Okay? So you might encounter a test that is BCR ABL. Don't be alarmed. If you see something like this, drinking buddies po kami. Ay, gusto ko yung may mga video na nagwawala si Joanna, ha. Gusto ko yung, woo, girl! Ganon, yung gumaganon-ganon. Kasi ikaw yung may accent na, woo, girl, you crazy! Ganon. Ganon dapat, alright? Alright. Okay, so, if you encounter a test or if you can encounter an analysis that says a BCR-ABL assay is used for what? Please answer CML, okay? Or measurement of the Philadelphia chromosome, or the concentration of Philadelphia chromosome in the patient, or the presence of the Philadelphia chromosome if they're using a qualitative test. Okay? So please be mindful of these one. Because I remember when I was a student, we would always send out hematology samples with the title BCR-ABL, and I didn't know what it was until I started teaching hematology, and then I realized, okay, it has something to do with the Philadelphia chromosome. Okay? Now, transcribe BCR. Ayan naman tayo. What's BCR? This is known as the break cluster region. Okay? And then it's the break cluster region. It's a nice to know acronym. I'm not gonna ask it in your exam, but just something that you might know. Just something that you might want to know if you have mnemonics. Okay? Now, there are several phases of CML, of course, that you need to remember. In chronic myelogenous leukemia, you're going to encounter accelerated phase and, of course, the blast cell phase. Okay? Or blast crisis phase. Or blast cell phase, blast crisis phase. Okay? So, in accelerated phase, it becomes asymptomatic to mild. There's 3 phases. Or, by the way, I forgot to mention the chronic phase. But let's talk about accelerated phase first. There's splenomegaly and basophilia. Okay? And it's seen in these cases, and there are more immature cells present. In blast cell crisis, clinically it behaves like an acute leukemia and can transform to either AML or ALL. So blast cell crisis. Why did they call this blast cell crisis? Because usually patients who encounter, or you would encounter patients would have high levels of WBC count, high WBC counts. Okay, we don't see them. That's why we have what you call, you don't see them. They don't appear to have a problem, and then after a certain time, specifically if they reach around 60 or 61 years old, 61 and above, they would notice begin to appear. Splenomegaly, then there's basophilia, okay? And then, immature cells begin to appear slowly. Okay? So, they begin to appear slowly. After some time, it almost the chronic anemia or the chronic phase ceases because there's no more increase in mature WBC counts. It becomes more so as younger forms become more present and becomes more evident, and that's why it usually transforms to AML or ALL. So it transitions from a chronic phase wherein there's just elevated levels of matured forms to an accelerated phase where slowly but surely there is increasing amounts of blast cells in the peripheral blood, and then on the last phase, which is basically the one where there is a no prognostic outcome, is the blast cell crisis. This is actually what happened to some of the famous actors in the Philippines, or singer in the Philippines. Can you give me one singer who died from chronic myelogenous leukemia? Chronic myelogenous leukemia. He's a singer or a rapper? I'm not sure.
Sir, Francis Magalona po.
Yeah, right? He was doing fine, right? One day he was doing fine. He was doing concerts and everything, and then out of the blue, you just heard that what happened to him? You just heard that he had leukemia. Oh, ganun pala kabilis, sir. Yeah, because he went through the accelerated phase and then blast crisis phase. Now, how does a doctor, or how does a health practitioner detect monitor this condition? The patient is known to be BCR ABL positive. Okay, his parents tested for the Philadelphia gene, the oncogene. Now, what's the simplest way for physicians to monitor the state of the patient's disease process? Simple lang. Napaka-simple. You don't need to think very far, or you don't need to think very deeply about it. CBC. Okay? CBC lang. We call it in our hospital here serial CBC. Monthly CBC analysis to determine how much the WBC increase on a monthly basis. The physicians can assess, okay, so the prognosis for this patient is still okay. We can let him go. We can let him go and do whatever he wants while doing therapy. Now it could be a combination of radiation therapy or chemotherapy. I don't know because it's not part of our practice. But you need to do a monitoring test, which is CBC or serial CBC analysis. Okay. In severe cases, especially those people who have been confirmed to have the Philadelphia chromosome, they would do weekly CBC analyses just to determine if the patient is at risk of having blast cell or blast crisis phase. Okay? All right? So cool. All right. Now, CML. CML cases can transform to ALL by what percentage? For AML, 30% or 70% of patients, 70% of CML cases become AML. For ALL, it's about 30%. Is it important? Yes. Now, what is the clinical chemistry findings of patients who have CML? You need to remember the patient's uric acid and patient's LDH. Alright? Due to increased cell turnover, there's going to be an increase in uric acid and LDH. Okay? Bakit? What do you mean by increased cell turnover? Means the cell death or cellular multiplication. The more nuclear material is being released into the bloodstream, the more uric acid there is. The more cellular divisions occur, the more uric acid you're going to see in the patient's serum. More hemolytic action happen. The more hemolytic action happen with leukemia. Yes, of course. Why? Because in CML there's continuous and steady production or abnormal steady production of blood cells. And the other cells usually lose a lot of nutrients because cancer cells are considered to be parasites as well. So they die off easily. Therefore, these parameters or these analytes will be expected to increase in these cases. Alright? Now, possible hematologic findings of a patient with CML. Obviously, the peripheral blood smear would show all stages of the WBC cellular development. Thrombocytosis is also expected to be increased at greater than 500,000. WBC count can range from 10,000 to 600,000. Okay? Okay ba? Clear? Clear pa? Naantok na. Naantok na ata sila, Sir Marco. Naantok na ata sila. Alright. Now, let's move on to the next phase. The next slide. What other disorder can often be confused with CML? It's leukemoid reaction. This is something that you need to remember. CML is often confused with leukemoid reaction. Actually, with any type of leukemia. But the most common one is leukemoid reaction. Why? Because as we mentioned before, the peripheral blood smear of that patient shows all stages of WBC cellular development. Okay? In leukemoid reaction, it's almost the same. Now, the one test to differentiate the two is LAP score. What's LAP score? Transcribe LAP. Manggigising tayo ng mga tao. Joanna, what's ALP? LAP, sorry.
Leukocyte acid phosphatase.
Alright, wonderful. Okay, good. Leukocyte acid phosphatase is the correct answer. Very good for Adrian's drinking buddy. Alright, now, what is expected in the LAP score of a patient with CML as compared to one with the leukemoid reaction? Well, CML has low LAP score, while a leukemoid reaction is expected to have a high LAP production. But why? Because the cells are working properly. Okay? The cells that a patient with leukemoid reaction It's not necessarily a neoplastic cell. Hence the term leukemoid. Leukemoid. Oid. Right? So parang leukemia. Parang. Kind of leukemia. In Latin, if you're using Latin, it's kinda leukemia. If you want to translate it into a much more current type of statement, it's kinda leukemia, but it's not really. Okay? So low siya in CML. Why? Because these cells are abnormal. They don't really function. Remember, although there's a lot of WBCs in leukemia, okay, these cells are not functional. Some of them, their job is to just multiply and multiply. Okay? So for patients with leukemoid reaction, the granules are working, the phagocytosis, the functioning, there is functioning phagocytosis, and that's the difference between these two. What does fish mean? Adrian, para mabawi mo yung pasalubong mo, anong ibig sabihin ng fish? Naku, Adrian, talagang ibibigay ko na kay Joanna. Fluorescence in situ hybridization. We're going to move on. Can you guys still hear me? Can you hear me? Can you hear me clearly? I got disconnected. I'm sorry. Okay, so that's the meaning of fish. Okay? Hindi isda ha. Alam ko may mga pilosopo sa atin, pero wag muna. Now, define what is a leukemoid reaction. Basically, it's an accelerated leukocytic response to a microbial pathogen. Okay? And there is no neoplasia. There's no neoplastic cell. Right? It's not cancerous. Now, what reagents do we use for lab score analysis? The agents that we use is naphthyl ASB1 phosphate to hydrolyze ALP in the neutrophils, and we use the stain aryl naphthylamide blue. Okay, aryl naphthylamide blue. And I think this is the last one in our discussion. And I think we have time for that for the next one. This is chronic lymphocytic leukemia. Okay, so for chronic lymphocytic leukemia, usually it affects elderly Caucasian males. Okay, remember, males are usually, in terms of epidemiology, males are much more at risk for developing or for getting cancer of the blood, or what we call leukemia. Okay, elderly Caucasian men. And they have what you call a staging system for CLL. Okay, so medical technologists are involved in the staging system, as you can see later on. And the staging system is known as the RAI staging system. RAI staging system. Okay, so the RAI staging system is basically like this. Ayan na naman. Ang dami na naman, sir. Ayoko na. Nakakahilo. I know. Ang dami kong memorizein, no? Tapos itatanong, nakikita ko yung mukha ni Mero. Ay, ni Joanna. Tsaka ni Charis. Nakikita ko yung mukha nila. Ang dami. Tsaka si Diandra. Oh. Si Diandra parang, sir, masakit ulo ko ha. Huwag ganyan. Nakikita ko yung itsura ni Diandra eh. Sir, ayoko ng ganyan. Huwag ganon. Bubugbugin na kita, sir. Parang ganun yung nakikita ko sa mukha ni Leandra eh. But unfortunately, we have to do this. Alright? So, staging system starts with 0 to 4. 0 to 4, okay? 0 to 4. For clinical presentation, lymphocytosis occurs in all stages. And the prognosis starts with good, intermediate, and then high risk. Alright? So when you say high risk, the prognostic outcome is not good. Anything, I think in every form of cancer, if you reach above stage 2, that is considered high risk already. Poor prognosis, high risk, anything under the sun associated to that one. Now, let's talk about stage 0. If there's just lymphocytosis, that's stage 0. Good prognosis? Yes. Now, what happens is lymphocytosis and then adenopathy happens. Lymphadenopathy happens. That is stage 2. For stage 3, lymphocytosis plus lymphadenopathy plus hepatosplenomegaly. Okay? So anything below these two, you need to include them as part of the symptomology. So aside from adenopathy, if there's hepatosplenomegaly, that patient is at stage 2. If the patient suffers from all of the previously mentioned symptoms plus anemia, that's stage 3. Now, the last one that's going to be affected is, of course, your platelets. So everything that I mentioned before plus thrombocytopenia, that is stage 4. Okay? Now, let's move on to the cells that are present in patients with CLL. Ayan na naman. Blood smears. Blood smear. What is the answer to this question? What cells are present in the blood smears of patients with CLL?
Smudge cells.
Okay, very good. Confident and fast answers. Very good, wonderful. True or false? True or false? Smudge cells can be done because of technical errors. True or false? Smudge cells can be done because of technical errors.
True.
Okay? Sabi ni Mayra, true daw. Sabi ni Joanna, true. Sabi ni Diandra, true daw. Okay, sino sa inyo tatlo mag-explain sa akin bakit?
Ano po yung tanong?
Stress ako sa inyo. Natatawa ako na stress ako sa inyo. Pero I love it. It keeps me alive.
Sa pag ini-state.
Alright, Diandra, try.
Forceful, ano po, smear.
Very good. Forceful smearing. True or false lang? Walang tanong. True or false? True or false? Smudge cells can be a product of technical errors. Forceful smearing is one of the reasons why you can have smudge cells or basket cells. Okay? So she's correct. Parang gusto kong ibigay kay Diandra talaga yung yung chocolate ni Adrian. Kasi si Adrian, he's not performing optimally today. I don't I'm a little bit disappointed with Adrian. Alright, so next. So the answer is smudge cells. Now let's move on to multiple myeloma. Okay? Now in multiple myeloma, if you listened to me earlier, you're going to have an answer to this question. What cells are affected in multiple myeloma? If you listened to me earlier, you'll be able to answer this question. What cells are affected in patients with multiple myeloma?
B cells po.
B cells. Specifically, what specific B cells? Oh, alright. Somebody answered already. Plasma cells. Now, what's the main problem with patients who have multiple myeloma? Is it the plasma cells in general or the products of the plasma cells?
Yung antibodies.
Yes, abnormal production of antibodies. Very good. Very good. Somebody is listening, or somebody was actually listening kahit na umiikot-ikot na yung mata sa dami nang memorize in. Right? Somebody's listening to me. Now, what abnormal substance is being produced in these plasma cells? That's the question that I gave you earlier. It's abnormal antibodies. Now, what's the main problem here? They produce antibodies. Di ba dapat okay yon? Kasi nga antibodies siya. It's for the immune system, right? Now remember, in cases of neoplasia, right? In cases of neoplasia, the problem is they mass produce things and it's not functional. Parang ano ba maganda? Bigay natin yung isang malaking country. They make a lot of they make a lot of things. Ayoko magsabi ng name kasi baka mamaya makasuan ako ng libel ng buong country. Pero you guys know this already. You buy a lot of stuff in Lazada. Alright? That one country mass produces a lot of materials or a lot of products. This one was made from that country, and I'm assuming it's about to it's in its last stage of its life right now because it's not very good, right? So it's the same with neoplasms. Okay, their products are abnormal, so the antibodies are non-functioning. Okay, non-functioning or semi-functioning, or if they function, they target the wrong things. Okay, sometimes they target the human body itself. Okay, so it's a detriment not only to the patient but also to the cells of the patient. Okay? Now, when we when we have serum electrophoresis of a patient with multiple myeloma, you're going to expect monoclonal gammopathy. Okay? What's monoclonal gammopathy? Monoclonal gammopathy is when you run it in electrophoresis. Yung sinasabi mo kanina sa akin, may Joanna, yung gumaganyan ka ng kamay mo. Gumaganon. Hindi, ano ba to Sara Duterte ba to? I'm not sure.
M-spike.
M-spike ang tawag doon. May M-spike tayong tinatawag doon. Mataas yung gamma region. Mas mataas pa siya sa albumin region. Okay? So, yung gamma globulin region, nagkakaroon ng spike. Hence the term M-spike. Okay? So when you run these samples in, okay? Now, yung kanina kong tinatanong, what is present in the urine of patients with monoclonal gammopathy or of multiple myeloma? Sabi ko kanina, it's a protein that coagulates at 45 degrees Celsius but dissolves at 100 degrees Celsius. Clinical microscopy question. Review lang siya. Sige, Joanna. Huwag niyo kalimutan. Sino? Very good. Wonderful. Huwag niyo kakalimutan si BJ. Okay? Huwag niyo kakalimutan si BJ. Alright? Benz Jones protein. Hoy, wag tumawan. May nakita ko may natawa. Kayo talaga ha? Dirty. Very naughty. Okay? Very naughty yung mga students talaga. Si Adrian, there's a smirk in your face, Adrian. I can see that smirk in your face the moment I said BJ. Alright? So don't forget the Benz Jones proteins. So what's the characteristic of a Benz Jones protein? What's the characteristic of Benz Jones protein? They are proteins in the urine that coagulates at 45 degrees Celsius but dissolves at 100 degrees Celsius. That's the general characteristic. Okay? Now, let's talk about the question for number 2. Since we're talking about blood smears a couple of days ago, or just like I think yesterday, right? What is the most common blood film presentation of a patient with multiple myeloma? Remember, this patient has a lot of proteins in the form of antibodies. So what will happen to the arrangement of the cells? They will form what? They will form very good. Rolu formation. What's the main reason that I mentioned earlier with Rolu formation? Hyperproteinemia. Right? Hyperproteinemia. Bakit pagka nagkaroon ng hyperproteinemia, ano ba mangyayari? Yung zeta potentials. Right? The zeta potential between the cells is decreased. What's the zeta potential? Blood bank naman. Pupunta na naman ako sa blood bank naman ngayon. Yung ionic cloud, remember, minus yon. Pag may dumaan na protein doon, magdidikit-dikit sila cells, and therefore they form Relu formation. Okay? Nagsa-stack sila. Nagets nyo? For blood bank, it's useful. This concept is useful because you want to agglutinate the cells faster. Okay? But for hematology, this is going to cause an increase in your ESR as well as Relu formation when you look at the peripheral blood film. Diba? Gets? Nagets? Okay? Relu formation. And also, there's a bluish tinge in between the cells or the cellular spaces. Okay? The spaces in the cell, around the cell, it's bluish tinged. Okay? Now, next. What is present in the urine of patients with MM? I've already mentioned that one. Benz-Jones protein. Huwag nyo kalimutan. Benz-Jones protein, okay? Layo muna tayo dun sa mga Twitter posts, ha? Okay? Meron tayong nakikita na kumakalat-kalat na scandal ngayon. Layo muna tayo dun sa Twitter. Ito muna tayo, yung BJ na matino. Okay? Benz-Jones protein. Alright? Ha? Hindi nyo alam yun yung kumakalat-kalat sa Twitter ngayon? My God.
Mamaya na kayo magtanong ng cheese.
Oo, mamaya na yun. Kasi we have more time later to make chika. Right now, we need to finish our slides. My God, children. Children of the corn. Characteristics of Benz-Jones protein. Coagulates at 45 degrees Celsius and then dissolves at 100. Now, let's talk about Waldenstrom's. This is actually, there's a Alright, so from the name itself, Waldenstrom's macroglobulinemia is what? Is what type of abnormal what type of hemoglobin na naman? Antibody. Nakita ko binubulong ni Joanna. Tama na yung sinasabi niya kasi binulong niya eh. What? Ano? Okay lang kahit hindi ka sure, gayahin mo nga si Adrian. Yung basta ka na lang babanat tapos kahit mali. Okay lang 'yun. Ang nabubuwisit ako, yung babanat ka ng mali pero tinuro ko na. Remember, pag hindi ko pa tinuro, hindi ako magagalit. Pero pag tinuro ko na, tapos may video na kayo, may lecture pa kayo, may pictures pa, tapos yung same picture ang ginamit ko para dun sa may question, dun ako nagagalit. Pero pag hindi nyo pa alam, okay lang yun kahit magkamali kayo. Okay? Kaya mag-alala. Chill lang ako. Alright, now, abnormality present in these types of cells or in these types of patient is the plasma cell, and they produce abnormal IgM. Hence the term macroglobulinemia. Okay? From the name itself. Now, the macroglobulins that react here are capable of reacting at low temperature. Hence the term also as cryoglobulinemia. Okay? So, cryoglobulins. Why? Normally, macroglobulins or IgM, they react at what? Room temperature or body temperature? Room temperature, right? But these macroglobulins are also capable in reacting at lower temperatures. Hence the term cryoglobulins. Okay? Now, let's move on to the next one. Okay? The most common clinical presentation of patients with macroglobulin disease is Raynaud's phenomenon. Okay? Are you guys familiar with Raynaud's phenomenon? Look at your fingers right now. Okay? Look at your fingers. Press your finger and you'll see white discoloration at the bottom part, right? Red on top, white on the bottom, right? Right? When you press on it. Now, in Raynaud's phenomenon, when there is cold temperatures, hence cryoglobulinins, what happens is you will have a reddish tinge on your extremities. Okay? It starts out as a white discoloration, and then after losing oxygen in the area, it undergoes a necrotic process. So medyo nabubulok na siya pag tumagal. Kasi yung mga IgM antibodies na abnormal, it occludes the capillaries on your extremities. Why on the extremities only? Because these are the places in the body that is less likely to receive blood supply. Bakit? If there's less blood supply, that part of the body is colder. Alright? So, hindi lang siya sa daliri, hindi lang din siya sa paa. Kundi sa paa rin. Okay? So, huwag nyo kakalimutan ha. Raynaud's phenomenon. Pisilin nyo lang yung kamay nyo. Okay? Namumula siya. 'Di ba? Tapos tingnan nyo yung ilalim. Yun yung start ng Raynaud's phenomenon. Okay? Tingnan nyo yung ilalim. Tinuro sa akin yan ng kaibigan kong doktor ngayon. Ganyan yung umpisa ng Raynaud's phenomenon. Tingnan mo yung kamay mo sa yung daliri mo. Yung nasa baba, yun yung start ng Raynaud's phenomenon. Pag tumagal na, nagkakaroon ng hypoxic state yung kamay mo, ay yung paa mo, or yung kamay, unti-unting nagiging pula, then nagiging violet, and then magiging green. Bakit nagiging green? Nabubulok na kasi. Okay? Alright? So, ganon. Okay? Sayang wala yung picture. Bakit wala siyang picture? Alright? Next. The blood of patients with macroglobulins are said to be viscous. Why? Because this is also known as hyperviscosity syndrome. So when you hear the term hyperviscosity syndrome, immediately assume it's either Waldenstrom's macroglobulinemia or hyperviscosity syndrome or cryoglobulin disease. Okay? Associated with the terms is Raynaud's phenomenon. Okay? Next. What is the serum viscosity? How is serum viscosity tested, by the way? We test serum by comparing it with water. Now, normal serum is 1.8 times more viscous than water. But in patients with Waldenstrom's, it's actually 4 times more viscous or 4 times greater with the basis of the viscosity index. We have a viscosity index test as well. Alright? Now, let us summarize the difference between multiple myeloma and Waldenstrom's macroglobulinemia. For the abnormal immunoglobulin type, you're going to see IgG. Okay, for multiple myeloma. For Waldenstrom's, it's IgM. And the ESR result for both is IgG is increased. Okay? But what's the main difference between the two? It's the immunoglobulins. Okay? And with 1 minute with 1 minute overtime, that is it. Thank you guys so much. Hopefully I don't see you next year if I get to be invited again in a seminar class. If I see you next year, it means the worst. It means it's the worst thing that would have happened. It means you failed in your seminar class. Okay? If I see you again. So I don't want to see you in your seminar class. Okay? Alright? So yun na siya. Hindi na tayo mag-start with coagulation. Magbibigay lang ako ng notes, tapos aralin nyo na lang siya. Medyo madali naman si coagulation, pero hindi ko pahihirapan yung mga exam ninyo. Pero you still have to study because Sir Marco, alam nyo naman, si Sir Marco mahilig yan mang-stress ng mga students, lalo na pag exam day. Di ba? Alright. So, what do we need to study up on in my exams? You need to study up on everything that I've talked about. Remember everything that I said that was important. Remember the case presentations, okay? Especially remember the vignettes that I told you about. For example, you have peripheral blood smear vignettes as well as electrophoresis vignettes, and what else? What else is there for you guys to remember? I'm not gonna include coagulation, but just a general question on coagulation analysis, okay? Or coagulation studies. Alright? Okay, mag-alala, hindi ako magtatanong ng mixing studies. Okay? Actually, it's obsolete in many countries aside from the Philippines. It's actually obsolete now. We have what you call DRVVT test, silicone clotting time. Ganun na yung mga test ngayon, and it's specific and it targets the specific factors na. Okay? So, wag kayong mag-alala, hindi ako magtatanong ng mixing studies kasi sasakit ang ulo ninyo doon. And even if I ask you guys that question, it's just one point. Pwede nyong hulaan. Now, chismis. Chismis.